The theme for this year's World Mental Health Day, which was on the 10th of October, centers around mental health services access. So today I thought, let me answer the question, where do I go to access mental health services in South Africa? I'm Dr. Gwanya-Mdletye. I'm a psychiatrist. So let's go. If you're in South Africa and you would like to access mental health services, you have several options, and it depends really on who you go to for mental health or for health services. If you access services through the public sector or through government services, a good place to start is always your local clinic. You'll be surprised at how knowledgeable the nurses and the doctors at the primary health level are in regard to mental health. Remember, in South Africa, in our training as medical practitioners, we all go through at least a rotation of psychiatry training. And so that is one place where you can access mental health services. Nurses often are very well versed in terms of treatment and diagnosis of mental illnesses. So the primary health services are a very often overlooked source or place where you can access mental health services. Some of the clinics even have psychologists that visit, and this is something that's available to you within the government health services. If you're someone who uses private or who accesses your mental health services through the private sector, your general practitioner is equally a great resource or a great place to start when you feel that you are struggling. You can also attend or make an appointment to see a psychologist, or you can actually even make an appointment to see a psychiatrist directly. These are all places where you can go and access primary health services. I must be honest, sometimes it is quite a challenge to get an appointment with a psychiatrist directly, and very often we have very long waiting lists. So going to see your general practitioner is often a very helpful first step. However, if the situation we are talking about is urgent, if there is an emergency and either your life or the lives or the safety of those around you is at risk, we're talking about a crisis here, right? And the important thing is to understand that in that kind of situation, it's important that you either attend to your nearest casualty department or emergency services. Alternatively, you can make use of some of the crisis lines that are available for the toll-free crisis line. SADAG, which is the South African Depression and Anxiety Group, have a crisis line 0800 567 567. CIPLA has a crisis line which is also toll-free 0800, and this is an easy one, 456 789. So those crisis lines are lines that you can reach out to, that you can make a call and have someone who is qualified and skilled attending you almost immediately. As I said, casualty is always a great place to go as in the face of an emergency or a mental health crisis. Remember, mental health is important, and when you are in crisis, it is very important to seek help. Thank you.